Hello, I am Dr. Mary Jo Ruggieri, and I am a holistic health professional. And welcome to Staying Well with Dr. Mary Jo. Let's talk today about infections. The fourth largest cause of death in this country, my friends, are hospital infections. So your chance of going into a hospital and coming out with a severe infection, sometimes death, is you have a good chance of doing that, which is sad. So I want to share a few things with you. The first thing is that when I did some research on this, the most prevalent thing that we could do to stop this onslaught of infections is washing the hands. And I'll tell you, there is a whole process behind it. And I don't think we, as practitioners of different holistic health modalities, and as clients and as people, we don't think about how long we wash our hands, how we wash them. So today I'm going to give you a few stats that I think are important. First of all, the CDC says that hand hygiene is the single most important procedure for preventing transmissions of what they call ARO, antibiotic-resistant organisms. Hospital infections, as I said, are the fourth largest cause of death in the U.S. Now, according to the CDC, 2,400,000 infections occur in the U.S. alone in hospitals. Causes directly 30,000 deaths per year and contributes to another 70,000 deaths per year because of the infections. So it is costing us over $2,300 per incident and $4.5 billion annually in extended care and treatment of infections. Now, something as simple as washing our hands. Now, what I want to say to you too is this isn't just for doctors and nurses, although it's important in the hospitals, very important, and not for just in critical cases, but this is for every day. I think that if you are working with a dentist, that's very important. If you're working with a massage therapist, a polarity practitioner, even if you're getting Reiki, if you're getting some type of work where you're working hands in hands with somebody, if you're working within a situation where you're in a class and you're working with each other and you're sharing different things, I think this is something that we have to really spread universally. So if we can take away 40 to 50 to 60%, they say in some of the research I've read, of infections due to hand hygiene, I think we should show how to do it. So let's roll up our sleeves, okay, and let's talk about washing the hands. It's such a simple thing, but once you really get to understand it, you understand that it takes a long time to do it right, and we don't think about washing everywhere in the hand. So the first thing we're going to do is to start with a good basic soap. I like to use Dr. Bonnard's soap. Has hemp oil in it. Hemp oil has a really key thing of really working on and being antiseptical. Any soap is going to work. I like some soaps that have essential oils in it. This has lavender in it, and I think it's very good. And it feels good as you're washing. You can have that wonderful aromatherapy smell of lavender to relax you. First thing you do is to get your hands wet. Okay? So you can run them. I just happen to have a nice pan here of water, but you get your hands wet. You take the soap and you put the soap in the middle of the hand, enough so that you're going to get a good lather. And you start by circling the hand. And the reason that is your hand has a large surface and many crevices. So you circle the hand and you start to really lather. That's important. I didn't realize it myself, is that you see how the changes come. So you really want to lather your hands so that you see a white film. Then you've got it. Then you start by rolling onto the back of your hands, and you just take that lather and you roll from front to back and put it all over. That's just the beginning now. And you take your time with it. I know some parents have their children slowly sing or go through the alphabet when they wash the hands. But I think if you get your children used to how to do this, to make the bubbles, make the lather, okay, now you're ready to start washing. First thing you do is you have to wash every finger. Because in the fingers you have all the V ports of the fingers, you've got all the areas, and you take and you just hold the finger and just do a rotation on every finger. All 10 fingers. And it's amazing because it will show how, I've seen the pictures of showing where the bacteria was on the hands before a simple washing versus a complete washing, and it's very significant. And the thumb. The thumb, you have the web of the thumb, and you go into the web, and you circle on the web, and you also rotate on the thumb. Now you have to do that on all 10. Now you still are lathering. Sometimes I go back to making the lather a little bit more. So I have that and I can put it and go back to the other hand and just rotate and wash on every hand and every finger. Now rotate, you have to get in between the webs of the finger, because don't forget your finger has 4 sides. You got a top, you got a bottom, and you have each side. So it doesn't do well just to wash the tops of your hands and to go like that and not open your fingers and work with every finger as you wash your hands. And teach people how to do it. School children are starting to take little lessons on how to wash the hand. Once you have washed everything, sometimes I'll take my thumb, because we use our thumbs a lot, and I'll go up and down the thumb. Now, also, here's the other variable. Go under your nails just very slightly, because they collect a lot of infection particles right under the nails. And just move them. It doesn't take a long time. You don't have to, spend hours doing it, but go under each nail. Now, it's good to maybe add some more water to it and go back to maybe causing some lather after you've done it. Now, your wrist all the way up through the about 3 inches on your wrist. You take and hold your wrist and cup it and just rotate your wrist. And 3 or 4 or 5 times, move it through, wring it down, and go to the other wrist. It's a very interesting process, and the more we can do it naturally and the more we can convince other people to do it. I think it's very important to ask to your massage person, have you washed your hands? I've talked to a lot of medical people who say one of the key things is they wouldn't go into a hospital for any type of service unless they had someone there to tell people as they walked in, hey, did you wash your hands? Again, 4th largest cause of death are hospital infections, and most of them are because of hands and instruments that aren't clean. So again, after you have done all that, they actually take it and rotate again. There's another method for cleaning the fingers. Let me show you that. Take your hands and you fold them in, and you can go like this. And as you move through, you just go all the way out. Kids like to, this is fun. Sometimes you can come under here and rotate your fingers. And I know it seems like, wow, what a process, but is it worth it when you're talking about one of our biggest problems are the transmission of infections? And when you're done with that, I sometimes just hold it and just let it rest. Then you take your hand and you can put it in the water and you can just rinse it off. And I always shut the water, and then you can go to a different, and always rinse with clean water, especially if you're working, if you have a faucet, that's fine. But that was water that I was washing my hands in, so I'm coming over to a clean. Now, there's a process of rinsing your hands too. And just take all the soap off first. Just wash all the soap off. If you have the faucet, that will work also. Good. And I also just come under and I just kind of maybe work through the tops, because right in the cuticles you carry a lot of bacteria. And I just soak them for a little bit. Then let it dry just slightly. Just shake your hands off. Again, if you're in the sink, you're doing there, just shake your hands off. Now have ready, and I don't like to use paper all the time, and if you have clean hand towels, but watch when you go to people's houses and things, if there's a hand towel there that people have been using, you're just spreading the infections one place to another. So you take a paper towel, have them there, and wiping your hands is important. You pat them dry, but you should go in and just wipe through every finger. Yes, is it a process? But what are the alternatives? And sometimes when you're done, you can throw it away and then maybe get another clean one. So if you have 2 sheets, then you make sure that they're dry. Now, I even read and have heard from different key people that don't reach for the handle and shut the handle off. Take your elbow and shut the handle off or the water off. If you're going to open the door, maybe open the door with your elbow, or if you have your paper towel, go and open the door. So at least you're starting out with clean hands, and I'll tell you, this is the carrier of most of our infections. So that's the whole demonstration. It takes a little bit of time. If we educate our people, or educate our children, if we as consumers are key in asking people, have you washed your hands? You don't want to be compulsive, obsessive about it, but we certainly could share with everyone this process. And again, in the hospitals especially. So thank you for being with us, and let's stop infections with good hand hygiene. Thank you.